Well, good morning, everybody. Jeff Slakey here on Daybreak, continuing with great conversations during Public Hospital Week. And we've got Dr. Alan Millard in studio today to talk about the end of the week's big celebration and free community health event, as they're adding men's health awareness and information to the mix this year. Good morning, Doctor. How are you doing?
I'm doing well, thank you.
Thanks for coming on the air with me this Saturday, a big event, and it has been a big event for many years. This year, a little different, as we're going to be adding some men's health awareness and information. What are types of pieces of information that the guys can receive this time around?
Well, they'll be doing blood pressure and blood sugar checks. Currently, the recommendations from most of the big organizations about prostate things is they don't recommend doing a PSA check, although there's a big review on that, and one of the largest organizations thinks they're going to change their recommendation back to going ahead and doing that prostate-specific antigen blood test.
Mm-hmm.
Right now, though, it's not recommended. They won't be doing that one up there.
Okay. But you said blood sugar, blood pressure. What are some inherent differences between men and women when it comes to those types of levels?
Well, in general, men start having cardiovascular disease, heart attacks, and strokes about 10 to 15 years earlier than women. It's quite unusual for a woman to have a heart attack before the age of 60. It's not at all unusual between 45 and 40 even for a man to have a heart attack or a stroke.
What are some ages that people should start thinking about this? 40 is a relatively young number when it comes to the health and longevity of folks.
Well, the thing to check even at a younger age is your blood pressure. Because if your blood pressure is 147 and you're 23 years old, the chance that you have that early stroke or heart attack is going to be significantly higher. So a blood pressure check frequently, like once a year, even after you're just out of high school.
Mm-hmm.
Again, you probably don't need to worry about checking your cholesterol when you're in your 20s or 30s. Probably not even so much when you're 40, but to start to do that when you're 50, checking your blood sugar depending upon how much you weigh at about age 40, and do that maybe at 40 and 45, and then more frequently after the age of 50.
What would be considered these days the obesity range for an average height? I imagine the average height of a male these days is 5'9", 6 foot maybe. What are some standard things that folks should be looking for weight-wise and things like that?
Well, a body mass index, which is a ratio of how tall you are to basically how thick you are, 19 to 24 is considered normal for a body mass index. I'm basically 5'10". For me to have a body mass index of 24, I should be around 170 pounds. Now, when you tell people that in the office, their eyes get big and they laugh a lot. We just are not used to seeing people at a normal body mass. Even if you watch the NFL, when you watch the linemen, they're significantly...
Some big boys.
Yeah, really big. And Caleb Schlotterhoff, when he was playing, he was about 305 pounds when he was playing for the Jets. And now that he's in medical school, he's about 245, 250.
Wow.
So he's lost a lot of weight and replaced it with muscle. He still works out in the gym all the time, and he's very fit. But he's lost about 50 pounds since he was playing.
You know, you always hear that guys will say, well, I'll go to the doctor sometime. I'm fine. And there may not be that fine designation for them. How do we encourage guys to take the time, go to the doctor, get things checked out?
Well, what I see a lot is you'll see a lot of 50-year-old guys come in. Why are you here today? Well, my wife.
Yeah.
So it's oftentimes the ladies are the ones that get the guys to come in. Most guys change the oil in their car fairly routinely. You don't wait until the engine blows up to change the oil. It's pretty pointless to do that then. So yeah, you need to put a little maintenance into the car, and then when you put maintenance into the car when it's younger, you get to keep it till it's a lot older.
That's a really good analogy.
And most people, though, don't do that.
Right.
They don't put the maintenance into their car. And for women, when they're supposed to be coming in for routine pap smears, they tend to come in all the time from the age of 21 on up. They're having babies. And the guys, as soon as they have their last sports physical when they're a junior for the basketball team, you don't see them again until their wife says, "You're 50, you got to go."
Yeah.
Once every 5 to 10 years between 20 and at least 40 is fine. So it's not something that you need to be doing every 3 months to come in and see us. Once a decade between 20 and 40 is plenty.
Wow.
As long as your body mass index is okay.
Sure.
If you're 6 foot and 325, you should be coming in more frequently because your blood sugar's likely to be going up. You're likely to be pre-diabetic. Your cholesterol's more likely to be off. And even if you're not diabetic, if your blood sugar's up and your blood pressure's up, that's metabolic syndrome, and basically your increased risk for heart attacks and strokes is the same with metabolic syndrome, which is the same as if you have diabetes, and that's the same as if you had a heart attack 6 weeks ago and they had to put stents in your heart. So it's quite a high risk.
Are there any signs for someone who may be on the verge of obesity or overweight, shortness of breath, just even going up a few flights of stairs, a few steps down the path to get the newspaper in the morning, and maybe some aches and pains that they may not have noticed over the years, but something kind of came on? Are there any of those signs that are we should go see somebody right away?
Yeah, those are all signs that you should, but those are all late signs.
Oh, okay.
That, the barn's already on fire then. It's not smoldering. It's already caught fire. So those are late stage things. If you're 20 pounds more than you were when you graduated high school, you're on the road.
Oh, wow. Okay.
So it's the bathroom scale.
Check it.
Yeah.
Folks, guys will have a chance this weekend here from 9 to 1, this free event, Saturday, May 13th at the Mason General Hospital in Shelton, a free community event to all now with some men's health awareness and information on blood sugar and blood pressure checks for the guys. There's a lot of other things that we've been talking about all week for this upcoming event. Happy to have in studio to talk about this and encourage everybody to stop by and get a little more health information. Dr. Alan Millard from the Mason General Hospital. Thanks for coming in.
Well, thank you for having me.